here today we have Dr.Christi Alsop. Hello.
Hi. It's good to be here.
We love to have you here. We're really excited that with your knowledge and with the amount of work you have done through your years, that you can share and that you can help people to understand that connection, the inner connection to the outer connection, and so on. How long have you done Oriental medicine, and what was that propelled you to choose that as your career and your passion?
I've been practicing for 20 years. When I was 13 years old, my mother took me to an acupuncturist in southern New Mexico, and she turned my life around in 3 or 4 months. I had horrible allergies, and really by the time I was 14, I knew what I wanted to do. So I went on to undergrad school and then came right up here and did graduate school. And I call her my teacher. So she taught me from the time I was 14 and really integrated into me traditional Chinese medicine all the way until I was 21 when I came up for graduate school.
Yeah, it's amazing. I had your work, and I have been into many acupuncturists and other people, and you got it right away. I was just so impressed. You're so connected, you know, and so from the heart.
Thank you.
It feels so good. What is your goal with your patients, and what do you look for on the first impression?
My goal really is to find the source or the root of the problem, and to help them understand, one, that they're partly responsible for their health, and I'm just a facilitator. And also, you know, I tell them that it's a part-time job to be responsible for your health. You know, it's about food. It's not, you know, it's about exercise, it's about meditation, it's about breathing, and acupuncture definitely is a piece of that, but I really look for the root of the problem for my patients and helping them understand their own health. And then also bridging the gap for them between allopathic medicine, maybe the medications they're taking, and then TCM, traditional Chinese medicine.
That is so good, because most people, it's like, no, this is my way and the only way. But helping them find and connecting them that they have the power, you're not taking the power away from them.
Right. That this is their body, and they can really learn how to heal themselves. And I'm a facilitator here to help them do that.
Very few people, and addressing the fact that sometimes allopathic medicine has a place when it's an emergency, and not to be condemning anything. You come from that place, which is so powerful.
Right.
And for you, teaching them, right?
Right.
Yeah. Can you talk about a bit about the different organ types? Because I understand that's...
Sure. It's the root of our medicine. It's the 5 elements. And so there's 5 different elements that we really work with. We work with earth, metal, water, wood, and fire. And they each correspond to an organ in our body. So earth is spleen, wood is liver, and then we have metal, which is the lungs, and we have water, which is the kidneys, and we have fire, which is the heart. And then each of those organs has a yin organ and a yang organ. And so right now we're in spleen time, spleen and stomach time. It's late summer, and we're going to be moving into lung time, which is autumn, and that's the lung and the large intestine together. So it's a good time to start working on your lungs.
So what is the physical, intellectual, and emotional functionality of all these different organs?
So we have the spleen, and the spleen tends to be worry. Okay, so we are the overthinking. So we'll tend to worry or we'll overthink. So many of us, especially in our society, you know, we'll be 5 steps ahead of ourselves or worrying all the time. And the Chinese believe, the traditional Chinese medicine believes that it really, you know, that damages the digestive process. And then there's metal, which is the lung, which we're moving into, and that is grief and sadness. And then we move into the kidneys, which is the winter time, and that is fear. And the way I would explain that to people is like young children, if they get really scared, they lose control of their bladder, right? So that's that's the fear, because the bladder and the kidney are paired organs. So we have the yin, which is the kidney, and the yang, which is the bladder. So, you know, when you get scared, you often pee. So,
Right.
and then we move into spring, which is liver, and that is anger. And one way to relate that to my patients often is when the liver gets stagnated with anger and fear. A lot of people will reach for some alcohol to soothe the liver, but then you have possible people who might get angry because that anger is released from the alcohol being in their system and going through the liver. So, you know, I tell people there's people who release that anger very well with alcohol, and they're the happy drunks, right? And or then there's the angry drunks.
Right.
So there's different. So that's one way that you can kind of relate to the liver and the stagnation and the anger. And then we go into summer, which is the heart and small intestine, and that's joy. And we can look at joy as there's positives to all these emotions as well. But we can look at joy as being overjoy as well, the negative. And overjoy can affect the heart in a way that it's kind of that manicness that some people might experience.
Yes, no,
So
I know that
the
well
translation
yeah.
now in modern times would be a manicness.
Manicness, yeah, I
Right,
see
right.
that. Yeah,
So
yeah,
that
yeah.
overjoy, that funny hee giggle, the kind of, you know, like the overjoy.
Oh, okay,
Okay.
right. It's,
So-
that's pretty
So we
amazing.
want to, you know, ground that through the small intestines. But
Okay, heart
That's-
and
that's
lung. Okay. How do you determine the type of organ of each individual that you're treating? How can you tell what personality organ they are?
so we look at the body. So there's different body types that match with every organ. And we also we take the pulse, and the pulse is a clear indicator of what's happening. There's 12 different pulses in Chinese medicine, and each match. And so we have the yin and the yang, and we take it on a superficial, middle, deep level as well. So we look, we listen, and we touch, and we feel. And so part of the looking is, someone who's, the best way I describe the lung, for example, a lung person, a metal person, think of a swimmer. Of a professional swimmer. Okay, so that they're very lung types. And usually we're not just one particular body type.
Oh, okay.
Usually we can be a combination, just like we're combination of Vita or Pitta or, you know.
Yeah.
Right.
In the Ayurvedic system.
In the Ayurvedic system,
Right.
exactly. In the traditional Chinese medicine system, you know, it's very similar. We're not just metal.
One type.
Right, we're metal and wood, you know, so then we'd be lung and liver.
Right. So
Right.
it's
And then I would work with those organs, because that's basically your constitution.
right.
And so,
yeah.
you know, those can be really strong, or those can be your weakness.
Right.
And so, but we see that through the pulse and the tongue, and listening to people's voices. And,
Right.
yeah,
What
and
they
looking
look-
at their skin and the
Right.
health of their skin. And so it's putting the whole, everything together.
An overall
Yeah.
assessment, which is so amazing because you do it so quick. I mean, you right away got me immediately what was going on, and I felt the shift that I never felt before.
Right. Oh.
Though I have been in major master homes and doing all kinds of things, you really have that gift of going straight on it, and it was understood
Right.
to you, and in a very gentle way, very soothing way. Do you have a questionnaire related to the different organ types that you use to evaluate each person, or you just use with the modality that you just said?
We do have a questionnaire when anybody comes into the clinic. We do, and then that helps us as well put, you know, your symptoms into
Right.
categories.
Okay.
Okay,
all
so if
right.
you have stomach ache, that would be, you know, let's say a spleen, or asthma,
Right.
chronic asthma, that goes into the lung, and they all interplay together.
Yeah.
But yes, so we do an intake, and then it helps me explain to people,
Right.
you know,
Because some people are
how
very
we
visual,
think.
right? And
Right.
the visual people, they love to, and lung
Right.
people usually like to write things down and
Yes.
like to know the
Yes.
A and B and Z.
Exactly.
And what amount of time.
Right. How many treatments
How
is
many
it going to be?
treatments?
Right.
In the lung people, when they're off, I noticed that they go into an obsessive orderly mode too.
Right.
I've seen
Yes,
that.
yes,
It's like,
yes.
wow. And their space is compromised. I'm a space person too, so
Right.
I can tell about my lung.
It's the breathing of the lungs.
I know,
Yeah,
right?
yeah.
Can you talk a little bit about the lung and the season coming up, the foods and the emotions, so people can look at themselves and have a little bit of a place to come, oh, okay, I'm a little off, or I'm good, or I should watch for this, oh, wow, I
Right.
should, yeah.
So we're going into the fall season, and you know, lungs don't like dryness. And living here in Santa Fe, it tends to be high and dry, and so there are a lot of ways that we can, you know, work with that. And moisture is key. You know, so and breathing is key. And then there's lots of foods. So the foods that feed the lungs are pungent foods. So we have turmeric and garlic and onions and cinnamon, and pears are for the moisture. So eating lots of good pears, you want to eat what's in season, and pears are ripe now. So, you know, cutting up a pear in the morning and adding some cinnamon in it, perfect for feeding the lungs. Even if you have if you get a cold, then you're going to want to use some essential oils. And some of those key essential oils are eucalyptus or peppermint or bergamot, because they open up and nourish the lungs. So those, you know, and then there's also Chinese herbs that you can take.
Right.
You know, and Wujian Yiqi is ginseng and astragalus. And not only does it nourish the spleen, but it also nourishes the lungs to keep the lungs strong. So often I'll have people start taking a preventative now to make them strong during the fall season.
Right, start before it happens. Yeah.
Right, exactly. So start eating some pungent foods right now. Start eating some ginger, or you know.
Isn't a particular color related to the food group for the lung?
It's white, which is pears, and so, you know, I often even have people visualize bringing white into their lungs or breathing in white light and out, because it's very healing for the lungs. Yeah.
And the sound, any
and
particular?
Onions are white as well.
Yeah. Any particular sound for the?
The sound for the lungs is like a snake. Yeah.
It's just like the snake sound. Yeah, I remember in Qigong.
Yes.
And it soothes you so much.
It does soothe you. If you're feeling sadness or grief during the fall time, it is a time where the leaves are falling off the trees. We're going more inside. You know, and so there are things you can do, you know, often lying on the ground with your hands up like this, and then making the sound is very soothing for the lungs and can also transmit grief and sadness.
Right.
And not holding on to that grief and sadness. And that's where the large intestine comes in, is being able to eliminate what you don't need to hold on to, and really working with the large intestine. And, you know, and that's where I also work with people to restore their gut.
Right.
And to use probiotics and other things.
Oh, okay. Yeah.
Yeah, to really, for, you know, healthy gut, healthy lungs, healthy large intestine, healthy lungs.
So because I realized that, well, large intestine, when the lung is off, usually constipation, right? Women have so much issue with that.
Right.
Yeah.
Exactly, with constipation. And so keeping, you know, so phlegm, if there's constipation, phlegm will often build up in the orifices, so in your sinuses or in your, you know, in your lungs. And so, yes, I really also work with the bowels, and pears again, and you know, they'll help keep the bowels moving and softer, and so you can move all that which you need to let go of.
Like nature does in fall. Let's go of its flowers, let's go and the leaves, and it goes into dormant. It's so easy for nature just to have that rest.
Right, it's rest time. We are, you know, and I ask my patients to slow down a little bit as we go into the fall, and then definitely, you know, in kidney time, in the deep of the winter, it's when you can, you know, restore yourself.
Right, restore, not be so out,
not to be so active and out. And yes, it's a quiet time.
And let's see here, the lung optimum function. what are the signs when it's optimally working?
When it's optimally, you have ease of breath and ease of movement, and it doesn't hurt. A lot of people, it hurts for them to take a deep breath, or they weren't taught traditional Qigong exercises and to learn to breathe deeper and lower. And so when the lung is functioning well, your bowels are also functioning well. You don't have sinus infections. You don't have allergies, because the orifices for the lungs is the nose. And as well, there's outer signs. Your skin is more clear and beautiful if your lung is functioning.
It looks moist,
really.
right?
It
The
looks
pore
moist
quality.
and clear. You're not having acne or eczema or rashes. So if the lung is functioning and detoxing and breathing in, and it's moist, then it shows on the outer as well.
I noticed that it's when the lung is off. Not only the outbreak, the skin looks dull.
Yes, exactly.
Right? Skin and hair and nails, right?
Right. They look dull and not vibrant, and so it's definitely an outer manifestation with the lungs.
Because the lung moves so much water.
It does. It moves water, and it helps root. When we take a deep breath, they say that the kidneys, again, root the lung. And so when you don't have cortisol and all these very active, adrenaline running through your body all the time, then there's a nice balance between the breath and the kidneys and being rooted.
The steam is moving.
The steam is moving and coming up from the kidneys and nourishing the lung, and then nourishing your skin. And you look well, and you don't have the color for the kidneys is for the face is ashy color. So people who are having a hard time getting enough oxygen and breathing will often, like you said, look very ashy and not well.
Right, they look dull, right?
They dull, and like the color for the spleen is yellow, and so you can see a yellowish tint if the spleen's not looking well.
Looking well, it's such a huge.
Or with liver disease, again, you also have a yellowish tinge to the face. So if somebody has hepatitis or
I've seen that because I work with skin for so many years.
Right.
What's the primary evil for the lungs?
Is the dryness.
The dryness.
Yeah. It's the dryness. So you want to make sure that you keep your nasal cavity nice and moist. There's lots of neti pots. There's ocean spray. There's lots of different ways you can do about that. And then just, breathing and
conscious of breathing, right?
Conscious of breathing, yes. And then also eating foods and drinking lots of water.
Right.
It's just key.
For me, I've seen that, I learned that when you think too much, you don't breathe.
Right, exactly. Coming back to yourself. One of my goals with my patients too, when they're on the table, is just have them breathe and come back and being aware and being in their bodies.
That there's a connection.
There's a connection. Yes, there really is a connection.
Traditional Chinese medicine usually talks about long time. What did that mean, and what happens in that time?
So long time is from 3 to 5 in the morning, and it's traditionally the time of day that the monks and almost every religion would get up and meditate and breathe. And so it's a beautiful time, if you happen to be awake around 5, to meditate and really focus on, that's the time where the qi is coming into the lungs. So it's a good time to really nourish the lungs, to get in that position and to meditate. So and then if you're waking up at 3, that's the transition. A lot of my patients wake up around 3 in the morning, and that's the transition where the qi's moving from the liver into the lungs. And so we often say that the liver overacts on the lungs. So I work on balancing the liver energy, calming that liver energy, getting rid of some of that angst.
It's so important.
So that they can breathe, dropping the diaphragm. And so I can really work with my patients around this. So if you're waking up around that time, there's usually an imbalance between
it's so important because it's a plague of non-sleep.
Right,
and drugs for sleep.
Right.
So
Right.
if we will to address these organs that they're keeping us up, or if the kidney is too low, it's going to keep you up,
Right.
and all
right.
that. And if you balance that with acupuncture, with your herbs, with your foods, and
Right.
your way of thinking, God, you don't need to take all these drugs,
Right,
God
right.
forbid, consistently,
Exactly.
that they stop working anyway and they damage so much.
And then your receptor sites get dull, and then they're not working anymore, and you have to take more. So yes,
Right.
it's much better if you can work with the time.
Because
of
even
the-
children, I had
Right.
a girl call me that she's only 18, that
Right.
she can't sleep right now.
Yes, these young children, they're under
Wow.
a lot of stress. It's a
Right.
shame that they have a lot of anxiety and a lot of stress. And they're also drinking a lot of caffeine.
I know.
You know, which so and encourage these young people to avoid caffeine as much as possible.
And I'm sure that affects the
Right.
kidney, the cortisol,
Exactly.
so it's a never-ending story.
Right.
Right. So the emotion you told me that regulates was the sorrow and
The sorrow
sadness.
and the grief and sadness.
Right.
Yes.
What about the traditional Chinese medicine when it comes to boundaries with lung?
So boundaries, so the lungs are, you know, again, it's the space to breathe, it's a space to you know, to have room with inside of ourselves and with
Right.
outside of ourselves. So it's, again, it's that breathing. And boundaries, I see it as also as discernment. So
Okay.
discernment of being able to, you know, what to hold on to, like I was speaking
Right,
earlier,
right.
and what to let go of.
Right.
So that discernment, you know, what are we holding on through constipation, or are we constantly letting go with
Right.
diarrhea, right? Is it just moving?
Oh,
Just
okay.
moving out of us, and there is no discernment.
Oh, I
Right,
see what
so-
you mean, yeah. When it's
right.
off balance like that.
When it's off balance, then we're not discerning, and it's off balance between the lungs and the large intestine. What to breathe in, what to take into our lives, and then what to
Right.
breathe out and let
Right.
go. So
Some-
that's how I see the discernment. And,
Yeah, one of my teachers once said to me that a person that didn't have a good father figure, or a father,
A strong
a
metal
strong
type.
father, the
Right.
father is the one, because it's a male situation with it's the father, the lung, right?
Yes,
Like
yes.
the spleen is the
It's the mother, exactly. It's Mother Earth, it's our digestion.
Right. So when it's not a really strong father figure, it was an abandonment of a father, or it was
Right.
only a mother.
Then we have asthma, and we have deep grief, and we have sadness. You know, a lot of the asthma or unbeing able to breathe comes from deep grief or sadness or loss of the father, or not empowering the metal energy.
Right.
So that father figure. So,
Right.
but then, you know, then you treat, interesting enough, you treat the kidney for something like that. You treat the jing, the jing that came down from the father, the essence. It's the
Oh.
DNA.
Fantastic.
So that's
Yeah.
how the 5 elements work together.
Oh,
So
I
you'll want to
see.
treat the kidneys to get rid of the fear, so that the lungs can breathe and stand up inside
Oh,
themselves.
fantastic. Because
Yeah.
I love for people that they have had the issue of father, you know, like I did, no father
Right.
presence there, or father
Right.
leaving when my mom was pregnant, things that I notice, okay?
right.
That is a very, very, you know, present feeling and memory that is in the subconscious for me.
Yes.
But it plays a huge role in my
Right.
health.
And so we strengthen the kidneys and strengthen the lungs to embody that in yourself. So you don't, you know, we won't need necessarily that from our father or for our
Right.
mother if it was a spleen issue. You know,
Self-sustain.
self-sustain. We
Fantastic.
build that up in ourselves.
Very, very, very good. Thank you for that, because I think it's so many people in between the lack of sleep and
Right.
these kind of behaviors that they're connected, so interconnected that we don't know, right? That they
Right,
play a huge
right.
role. Because we just not dealing with the head only, and
Right,
or our
right.
feet, or
Right, or just, you know, and again, integrating. I'm not saying, you know, they should maybe go to their therapist and try to work out this father figure and everything. But if you balance the lungs and the kidneys, how much quicker therapy might go.
how much easier.
Right, and how much easier, and how they'll feel self-confident in themselves so much quicker.
It's so amazing. We thank you so much. I think so many people, we have this all over the world, and so many races we've blown away that we're missing just
Yeah.
a tiny little piece of Greenland, and that you can share this with so many cultures in so many languages. We are so honored and thankful, Doctor, for having you.
Oh, thank you
Thank
so
you
much.
so much for all your knowledge and
Yeah.
your help.
It was great being here. Thank you.